Hi, my name is Catherine Keane and today I'm completing Assessment 3 for Unit HST6350. Today I'm a nurse practitioner at a GP clinic and I'm here to dress my patient's wound on her head. Hi Emily, so my name's Catherine, I'm going to be your nurse for today. So do you want to tell me just a bit about how you got this laceration to your forehead?
Yeah, sorry, I'm just really embarrassed. I was out on the weekend and I had way too much to drink. It's the tequila. When I drink tequila, I get really aggro. Anyway, this girl picked a fight with me and I got really out of control. Pretty much she slammed me on the floor and I face planted, and that's how I ended up with this.
Okay. So do you know this girl that you got into a fight with? Or? Okay. So whereabouts were you when this happened?
Northbridge.
And were you out for a special occasion, or were you just out drinking, like with your friends?
Yeah, it was my friend's birthday. I feel so bad. I feel like I've ruined her special occasion. Anyway.
So how many sound drinks do you think you had that night?
I think I had about 10 at Pre's and then another 4 tequila shots while out.
Okay, so that's quite a lot of alcohol that you've consumed. So do you often have these situations where you get quite angry and aggressive when you've been drinking?
I go out drinking most weekends, but I find I get more aggro when I drink tequila.
Okay. So I'm just going to ask you a bit about alcohol. So what do you know about alcohol and the sort of health risks it can put you at?
No, it's not great for you, and I see when my parents drink too much, they're the same, getting angry, and yeah.
Okay, so do you mind if I tell you a bit about alcohol? So drinking at risky levels, it can put you at a risk of so many different health conditions like cardiovascular disease, liver cirrhosis, early onset dementia, stomach issues, all different types of cancer, aggression and violence, which you've seen, and we obviously want to try and reduce your risk of having those sort of adverse health reactions. So for the patients that we see, if we see that they sort of may have sort of an alcohol issue or drink alcohol on a regular basis, we have to complete an audit, which is a screening tool, and it's just for all patients that come in, and it's just that we can sort of get an indication as to how much you're drinking, and then we can sort of put interventions in place to kind of help you reduce your drinking or refer you to somebody on who could potentially help you further with that. So would that be okay if we did that today?
Yeah, I think I've heard of it before.
Okay, cool. So Emily, we're going to go ahead now and complete the alcohol screening tool, if that's okay with you. It's just a set of 10 questions and it's completely confidential.
Yeah, I really don't want my parents finding out about this.
Yeah, that's fine. We won't be passing any information on to them. So the first question is, how often do you have a drink containing alcohol? So never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week?
I'd say 2 to 4 times a month.
Okay. So how many drinks containing alcohol do you have on a typical day when you're drinking? So we've got 1 or 2, 3 or 4, 5 or 6, 7 to 9, or 10 or more.
10 or more.
So the third question is, how often do you have 6 or more standard drinks on one occasion? So we've got never, less than monthly, weekly, or daily, or almost daily.
Weekly.
Fourth question is, how often during the last year have you found that you were not able to stop drinking once you started? So you've got never, less than monthly, weekly, or daily, or almost daily.
Weekly.
So how often during the last year have you failed to do what was normally expected of you because you've been drinking? So never, less than monthly, weekly, daily, or almost daily.
I'd say never. I don't really have any responsibilities. I have most weekends off of work, so yeah, never.
And how often during the last year have you needed to drink first thing in the morning to get yourself going after a heavy drinking session the previous day or night?
Oh, never. I couldn't think of anything worse.
Never? Okay. And how often during the last year have you had feelings of guilt or remorse after you've been drinking? So you've got never, less than monthly, monthly, weekly, or daily, or almost daily.
Less than monthly, I'd say.
And how often during the last year have you been unable to remember what happened the night before because you've been drinking?
Monthly.
And have you or anyone else been injured because of your drinking?
Yes.
Okay. Yes, but not in the last year, or yes during the last year?
Yeah. In the last year.
Okay. Has a relative, friend, or doctor or other healthcare worker been concerned about your drinking or suggested you to cut down?
No.
Okay. So you've scored 19 for the alcohol screening tool. So a score of 13 or plus is a high risk, and you were 19. So we recommend that we can do a referral to alcohol and other drug services. So that's basically just someone who's more experienced, you know, dealing with people who can have alcohol, other drug related issues, and they can give you, you know, counselling and one-to-one time on, you know, how you can overcome this and work towards a goal, maybe to, you know, drink a bit less and not have, you know, come in with injuries.
Yeah,
How
I
does
think
that
that's
sound?
a good idea, because I can't keep going on like this.
Yeah. We don't want to have to see you in here, you know, it's not, you know, we don't want to see you injured.
It's embarrassing, and you know, I don't want to lose friends over it.
Okay. So what are some interventions that, you know, you think you could do, or some goals you could try, like how would you achieve your goals of reducing your drinking? What are some things you could put in place maybe on the weekend so that you don't, you know, get to this risky level of drinking and injure yourself again?
I don't know, it's really hard because I feel like my friends are bad influences, you know, and we buy each other rounds, like we take turns in buying each other drinks, which kind of just like makes me want to drink more. Yeah, I don't know, can't really think of anything.
Nothing that you think you could do? Okay. So we've got some interventions. So we could say no more than 2 standard drinks per day, no more than 4 standard drinks on one single occasion, and aim for at least 2 alcohol-free days per week. And a follow-up to, obviously you'll follow up with the alcohol and other drug referral that I'll be giving you, and to see your GP as well to discuss what's sort of been going on. You know, with your friends, if you say you're doing rounds, you know, you could be designated driver, so I guess you don't have to drink that night, and then, you know, because you're driving, that obviously you've got responsibility.
Yeah.
So you could suggest that to your friends.
Yeah, and that just gave me a good idea. I guess I could, you know, only transfer a certain amount of money in my account, so then I don't have the money to spend on more drinks. Yeah, that's really helpful, thank you.
And maybe if, you know, if your friends are caring, you could tell them about what's happened today, and tell them about your goals and, you know, what's wrong, and then hopefully, you know, they would understand that. Maybe they wouldn't encourage you to drink so much when you go out.
Yeah, that's a good idea. I think they would be really supportive.
You can also get apps on your phone which help you to track your drinks. So, you know, when you're drinking, you may not be aware of how much you've had, and you can get some apps on your phone which you can track how many you've had, so then you sort of know when to stop.
Yeah. Okay.
Yeah. Okay. All right. Well, now that we've done that, should we just get to that head wound, and I can dress that for you and get you out of here?
Yes, please. It's not going to hurt too much, is it?
No, it shouldn't be too bad.